Hi, I'm Kendall, and this is my policy briefing on the concerning U.S. reliance on China for pharmaceuticals. For the past 20 years, the United States' dependence on China for pharmaceuticals has significantly increased, with the cost of imports rising from $30 million to over $2 billion. We first saw these increases in 2017, however, they really grew during the COVID 19 pandemic. This dependability on outsourced drug manufacturing raises potential safety concerns and threats to our national security. So, why is China a big concern? China is the largest producer of APIs, that means active pharmaceutical ingredients, in the world. 80% of the United States API supply comes from China. We use APIs heavily within our drug market as they're used in chronic illness medications, antibiotics, and other drugs. So, how is China able to be the leading API producer? For starters, there's a lower production cost as well as lower labor costs. There's government support from the Chinese government, and Chinese manufacturers are able to price APIs 35 to 40% lower than Western competitors, while at the same time maintaining FDA and EMA quality standards. So, what is our current policy? Right now, there's just FDA regulations. The United States policy allows the importation of pharmaceuticals from China as long as they meet the FDA standards for quality, safety, and effectiveness. Specifically, imported drugs must be manufactured under sanitary conditions, they cannot be altered or misbranded, and they must meet any registration, listing, and filling requirements. Additionally, with our policy on April 4th, 2025, President Trump signed an executive order imposing a 104% tariff on pharmaceutical products imported from China. This action aims to address concerns related to the synthetic opioid supply chain originating from China. However, the concerns are that these tariffs could impact the availability and affordability of essential medications that American people depend on. So, what is the big issue with importing pharmaceuticals? The safety concerns are the main part. Chinese and Indian manufacturers receive the most FDA warning letters. They have carcinogens in the medicines. They've been caught destroying or falsifying data, and they use non sterile manufacturing processes most of the time. Additionally, there is significant supply chain damage, as we rely heavily on China for active pharmaceutical ingredients, and any disruption in the political, economic, or natural state can stall this production. For example, 90% of the US supply of certain antibiotics and APIs come from China. So if China were to have anything politically come up with the United States, that's 90 plus percent of our antibiotic and API supply that is now up for risk. So, what can we do to change this? My policy recommendation is that we use federal spending money to design and build new pharmaceutical production facilities. This will ensure we are creating our own products without the need for importation. Additionally, because we're using federal funds, we can then mandate that federal agencies must buy from pharmaceuticals owned by US facilities. This will eliminate the need for mass importation. Additionally, we will have the FDA put an emphasis on every drug label to make sure the American people know exactly where they are buying from. The FDA will also need to put out more information about the dangers of imported medications as we see fentanyl deaths skyrocket throughout our country. If Americans understand the risk associated with imported medications, they are more likely to purchase US owned products, and over time, the sales money will be enough to keep our drug manufacturing running in the United States. Lastly, we have an immense amount of allies that we could work with to solve this issue. We're able to work with countries like India, Japan, Australia, and we can now trade with non Chinese pharmaceuticals. These other countries are just as concerned about China as we are. India is one of the largest drug manufacturers in the world and would also like to reduce their dependence on China. Also, we could cut tariff costs with these countries to foster a more friendly business environment, and it would make it cheaper for everyone involved. With the expected policy outcomes, elites have made billions off cheap manufacturing in China, and they will argue that these new policies will raise the cost of buying. Big Pharma is also willing to argue anything to keep their pockets lined, as they make too much money off China. However, we as a country cannot afford to keep the nation's security risk at bay. The US's opportunity at wide scale pharmaceutical exportation can bring in lots of money to the United States. There will be a lot of suspicion around the US's new manufacturing steps. However, it will be best for everyone in the end. Thank you.